Well, for the UK practice, in the adjuvant setting, we have approval for adjuvant atezolizumab for a year. And this is only in 50% positive PD-L1 patients that have had a complete resection. There are lots of unanswered questions in that area. How long do people really need to have treatment for? How many people are really eligible for this? Because my personal experience is, although ostensibly you would think it's a reasonable number of patients, the reality is that patients are quite washed out, tired, recovering from their adjuvant chemotherapy, and not all of them are that fit for adjuvant immunotherapy. So the number of patients that I've, in my practice, actually treated with this is much smaller than I would have thought initially. I think the main area, we haven't had any updates yet, but I think there will be at this meeting tomorrow, the main area that's exciting in the early lung cancer space is the introduction of the concept of giving chemo-immunotherapy before surgery. So there are two studies that have been repeatedly presented at ASCO, World Lung, and ESMO, called CheckMate 816 and the NADIM study, that really do show very substantial benefits on multiple efficacy endpoints for 3 cycles of neoadjuvant chemo-IO preoperatively. Now, that's not a standard of care at the moment. We may have just had a license, but it's not reimbursed in the UK yet. But my sense is that's something that will change in the forthcoming year.